We're going to put 3 implants in, okay, sir?
Yeah.
Two on one side and 1 on the other. And I'm going to use 2.5 by 13 millimeter implants. So what we'll do is we'll put the implants in, we'll put temporaries on, and then when you get back home, you'll have your staff take a final impression, okay? Mm-hmm. And send it into it. Little pinch. Okay. We're going to do the right one first. Okay. First implant. You hear the beeping? So it stopped at 30, now we're going up to 60. And it stopped at 60. So we got that in there nice and tight. I'm going to go one more turn. Can I also have, yeah, you read my mind.
Short one?
Short one. Bite together. Bite. Open. All right, we're going to use one of our True Lock abutments. So I'm going to show you how to do that. So you'll notice that we line the square of the implant up toward the buckle. Okay? And if you look at the peak abutment, there is a square internal on the bottom of the abutment. So what we're going to do is take the peak abutment, and there's also a flat side of the abutment. We're going to line the flat side of the peak abutment up with the flat side of the implant. So first thing you have to do is push it over. So we're going to, same thing, we're going to line up the abutment with the side of the implant that's flat and snap it into place. There we go. Snap right in. So the abutment is on there. Can you see that, everybody? So now, of course, that's too long, so we're going to do a little crown prep on that abutment. They're called True Lock abutment, so you don't need any cement. They snap on. And then you just cement the crown to the abutment. And then you don't have any cement at the gingival line. So we made that abutment shorter. Play together. That's perfect. So now it's just like a crown prep. And when we make the crown, they can finish the margins right to the edge of the abutment. Here though. Let's go ahead and do the other side now. On the other side, I typically don't use the abutments on molars. On the molars, I just use the O-balls because there's 2 of them and it's just easier to use just the O-balls. Turn your head toward me a little bit. So we're going to go ahead and do the other side now. Feel that a little bit? Okay. Maybe a little bit on the buckle here. Turn toward me. Almost done.
That's in.
Okay. Bite together. Bite. Bite. Open. This left side's been out longer than the right. Because your upper tooth erupted more. Bite together. Okay, let's do the other one. We're going to have to do a little tiny bit of adjustment on the occlusal of the upper molar because it's dropped down. Better? That time? Not too bad? Okay. Let me just do a little adjustment on the upper tooth. Make a little room. Tooth's only been out for 2 years? It's amazing how much how much the upper tooth erupted. This one? 3 years. 3?
Here 1, this one 3.
Oh, okay. Yeah, the upper tooth really super erupted pretty quickly. Okay. All right, let's go ahead and take impressions.
Both at the same time?
Sure.
All right.
So we're just going to take impressions directly on the implants. Like I said, I use the abutments on anterior teeth primarily, or a single posterior, but I don't use them when I do a double implant.
Stay open.
Bite together. Bite.
Just keep biting.
And this is the Kettenbach impression material that we were talking about yesterday, Kettenbach's product. It's a super product. It's very hydrophilic. And this is called Panasil. And then the heavy body is also Panasil. And then we have Silginate, which is the alginate substitute. And that sets up faster and it's a heavier body. So we only use the Kettenbach impression materials now. And it's really a great product. So okay, so open up. So you see what a nice impression we got here of the number 29, and here of the number 19, perfect impression. And now we're just going to put a shim, these are the larger shims. So I'm going to put a larger shim over, we call these the one-piece shims. We're going to put that over the abutment on this side. And then we're going to make a temporary over the top of that. And that way when he gets his crown in 2 weeks, his assistant can pop off this temporary without too much difficulty. And then cement the permanent crown on. Or he can do it himself, or have a dentist do it. Bite together. Open. Okay, go ahead and cure it. Healing caps on the other side. Might have to trim one of them. Sometimes if the implants are a little close, you just have to trim a little bit at the base of the healing cap so that it slides down.
Is that for tissue relief or for?
No, so that the two healing caps don't bump into each other. Make a little room.
I don't know.
Okay. Bite again. Open. And cure it. So 4 surgeries in less than, let's see, 8:30, 9:30, 10:30, 11, 3.5 hours. So nothing too hard, open, nothing too hard or crunchy. And these until we get the permanent crowns done, okay? And we'll send the crowns to you in about 2 weeks, okay? Bite again. Bite. Open. How about now? Better? Okay, all done. So we'll get a post-op x-ray and then we'll all go to lunch.